Have you ever wondered what would happen if your heart suddenly stopped beating for just a brief moment? The heart, the symbol of love, the source of life, is the most persistent organ in your body. Every beat carries blood, oxygen, and life to every cell. But when the heart no longer maintains its rhythm, disorders occur silently and slowly. It can be a warning sign that you are facing cardiovascular disease, the silent killer that causes millions of people around the world to collapse every year. Sadly, most of us often ignore our heart's early warning signs. A little shortness of breath, a fleeting chest pain, or just everyday fatigue. It's easy to make excuses for them, blaming busy work, lack of sleep, or stress. But few people realize that these seemingly small signs are actually cries for help from the heart, an organ that is exhausted from having to work hard in unfavorable conditions. Let's embark on a journey to discover this disease, to better understand the causes of heart fragility, the signs that cannot be ignored, and especially the importance of listening to your own body before it's too late. Cardiovascular disease is not a single disease. It is a collection of disorders involving the heart and vascular system, seriously affecting the ability of the most important organ in the body to function. From myocardial infarction, stroke, atherosclerosis, arrhythmia to heart failure, each disease is a separate and dangerous story. Regardless of age, gender, or profession, cardiovascular disease can knock on the door of anyone, from enthusiastic young people to respected seniors. Imagine you are living a normal life, but in the blink of an eye, an angina attack can take it all away. Cardiovascular disease not only affects physical health, but also destroys the patient's spirit. Constant anxiety and stress, combined with lifelong treatment costs, create a significant burden for both the patient and their family. Like any major crisis, the root cause of cardiovascular disease is not a single factor, but a combination of different risk factors. Unhealthy lifestyle habits, poor diet, and increasing life pressures are all pieces of this dark picture. One of the most frightening causes is tobacco. Did you know that every time you inhale a puff of cigarette smoke, you are directly introducing a series of toxic substances such as nicotine and carbon monoxide into your body? These substances not only constrict blood vessels but also destroy the structure of the arterial walls, causing them to gradually harden and lose elasticity. The consequences? Blocked arteries, heart attacks, and strokes. Inactivity is also a big problem. Sitting in front of a computer screen for hours without exercise causes the body to become sluggish, fat to accumulate, and the circulatory system to gradually weaken. What about obesity? It is not just a cosmetic problem, but a major potential risk to cardiovascular health. Excess fat, especially in the abdominal area, not only increases bad cholesterol but also leads to high blood pressure and diabetes, both of which are sworn enemies of the heart. Plus, imagine your heart having to work under constant high blood pressure. Blood vessel walls that are under great pressure for a long time will become thicker, stiffer, and eventually lose their elasticity. As a result, the heart has to pump blood harder to stay alive, leading to an increased risk of heart attack and stroke. Diabetes is not out of the list. High blood sugar damages small blood vessels, reducing blood flow and increasing the risk of plaque formation. Combined with obesity and high blood pressure, diabetes becomes a time bomb for cardiovascular health. If you feel short of breath even when you are not exercising vigorously, it could be a sign that your heart is in trouble. Shortness of breath when lying down, even while sleeping, is a sign of heart failure. Similarly, a feeling of tightness in your chest as if someone is squeezing your ribcage is a red flag that should not be ignored. Swelling in the legs, persistent fatigue, and persistent cough are also symptoms that warn you to see a doctor immediately. In particular, if you often feel dizzy or even faint, it is very likely that your heart is on strike and not pumping enough blood to the brain. Not only does it damage the body, cardiovascular disease also creates a huge psychological burden. Many patients face feelings of anxiety, stress, and depression when they know that their heart is no longer healthy. Helplessness and fear of sudden heart attacks or strokes take away joy and hope from their lives. These negative emotions not only reduce the quality of life but can also make the condition worse. This cycle continues, turning heart disease into not just a physical illness but also a major mental health challenge. Imagine your life without a steady beat. Scary, right? But don't worry, you can change your heart's future starting today. A healthy diet with lots of green vegetables, fruits, and limited saturated fat will be the first gift for your heart. Regular exercise, even just 30 minutes of walking a day, is enough to make your heart stronger. More importantly, quit smoking. It's never too late to say goodbye to the heart's #1 enemy. Listen to your body. Don't ignore any unusual signs, no matter how small. Love your heart by taking care of it properly, because only when the heart is healthy, only then can you fully enjoy all the beautiful things that life has to offer. Your heart, don't wait until it really screams for help.
Please like and subscribe to the channel to get more useful knowledge for you. Access link in the description. Thank you for watching. Goodbye and see you again.